Okay. Ready, Sam? Good afternoon. Thanks for everyone for joining us. This is a very special day and a special week. This is Nurse Appreciation Day and Nurse Appreciation Week. And that is always fitting, given what these professionals mean in our family and individual lives. But it is obviously the most appreciative probably the state has ever been for our nurses for very, very good reason. We've seen what they're doing for our families in incredibly challenging times. We think of them, and I think of Zeke Cisneros, who is a nurse we lost on April 13th at Eastern State Hospital. And I understand his wife is a nurse as well. And when I think of Mr. Cisneros, that's just every single nurse, every day facing that right now. And I'm glad to be able to say that we have over 7 million Washingtonians who hold these nurses in our hearts right now. We know that hundreds of our nurses have fallen ill due to COVID-19 while treating patients, and their jobs are always tough. I think that's something sometimes you forget. They're always tough jobs, but so much more so now when we see the hours they have to stand in extremely hygienic conditions to watch these extremely ill patients. Nationwide, the CDC estimates that over 9,000 frontline nurses have been ill and dozens of nurses have lost their lives in the line of duty. And whether it's long days in a clinic or long nights in a hospital, we know that they're standing there a day and night. And we know we've heard the stories when we talk to people who are survivors and the survivors' families and those who do not survive. You know, it's almost always the first thing they say is they are so grateful that nurse who stood by them in their hour of need. They recognize what nurses mean, and so do we, I think, throughout the state of Washington. So the least we can do is to appreciate them today, but also be committed to getting them the personal protective equipment that they need and that they deserve. And this is a super high priority for the state of Washington. Our administration is dedicated to getting these nurses the PPE they need. I know that on the many, many calls I make following up leads to try to find this equipment for these nurses, I'm thinking of the nurses on every single one of those calls. And I know that we have more work to do in that regard. We're hopeful that the President will be more assertive in using the Defense Production Act to actually order companies to actually manufacture this product. And we hope that that will increase the supply in our state and in our nation, because frankly, that's really the only ultimate solution. We're searching the world for this material for these nurses, and we ought to have our own domestic manufacturing industry to make them. So we are hopeful that can be stood up in the near term. That is starting, but we've got a long ways to go. But even through these difficult times when nurses have not had what they need, they have always been on the post. And it's been amazing to see their courage in those difficult circumstances. And we're so appreciative of every single one of them across the state from what they've done. If there's been any more selfless compassion in our state, I'm not sure that I've seen it, at least outside of wartime. And that's what this is, in effect. Today we have some great representatives of this profession. Diane Stedham-Jewell of the Providence facility in Centralia, Justin Gill of the Providence Urgent Care in Mill Creek, and Katie Bray of Harborview Center in Seattle. And I'm looking forward to this discussion with them. I hope we can all learn something about this amazing profession. So why don't we stand for questions? I think we're going to start with Diane, I believe. Diane, thanks for joining us today.
Governor Inslee, and thanks for having us here today and in honor of National Nurses Day. And I'd just like to take a minute and wish my fellow nurses out there a happy day and here's to a better year to come. And also to just give a shout out to the other healthcare workers in our facilities, because as nurses, we're just one cog in the wheel, and it really takes a whole facility to take care of our patients in our community. So we've been doing that here at Providence Centre, and I'm proud of our staff here. We were asked to talk a little bit about what's happened in the last 6 weeks or so, and it seems like things are moving in a little bit more of a normal, whatever normal is, the new normal. The first 3 weeks were definitely challenging because I think things were just changing so rapidly and there was so much unknown. Would we have enough PPE? Would it be the right PPE? You know, there was just a lot of questions, and whatever the policy was at 7 o'clock in the morning might have changed by 3 o'clock that afternoon. But that seems to be slowing down some, and we're grateful for that. And as caregivers, we were frightened. We weren't sure what was happening, and you know, this is can be a deadly virus. And as caregivers, we were frightened. Our patients were frightened. So there was a lot of uncertainty. But I think as we're into this now about 6 weeks, things seem to be calming a little bit. We are so grateful to the community and to the state for going into action and taking to heart the stay home, stay safe order. And we just, as a community, really hope as we gear up to restart surgeries, which is the area I work in, that they continue to follow that order, because we want our patients safe, we want our staff safe. And I think that's the only way that right now we're going to get through this is to follow that. And I appreciate the action that you've taken in Washington State to ensure that. So thank you from myself personally and my other coworkers.
Elective surgery starting back up. We like to see you working hard, so I'm glad that that's starting up. I know patients are going to be really, really happy about that.
They are.
Who need some joints fixed, so thanks for your work. Justin Gill of Providence in Mill Creek. Justin, could you give us a few comments?
Yes, thank you, Governor, for having us all here today, and happy Nurses Week to all my nursing colleagues throughout the state and in the country. As you had mentioned, I work as a nurse practitioner in a walk-in clinic with Providence here in Mill Creek. I also teach health policy at UW and work with the WSNA, Washington State Nurses Association, on their health policy council. You know, I would have to echo Diane's comments. You know, I still remember in the beginning when things were literally changing hour by hour. And as part of the clinic and the health system here in Snohomish County with Providence that saw and dealt with the first COVID positive patient, you know, there was a lot of fear among the staff as well as the patients that we were seeing. I can still recall working in the week following the first community transmission in Snohomish County, and you know, patients were coming in and there was a lot of uncertainty. And for us as healthcare workers, I think it was really, we were fortunate enough to have the appropriate protective equipment, at least initially, and have strong leadership from our healthcare leaders here at our clinic. And, you know, I think it speaks to how, as a profession, we do work with our colleagues, our physician colleagues, as well as all those that are involved in the healthcare system to really take care of our patients. I would have to agree. I've seen a change over the past few weeks, and I'm certainly proud to be a part of the state that has seemed to have flattened the curve and is heading in the right direction. You know, I think it's definitely something where we need to continue to hold these, you know, at least restrictions in place so that way we can continue to flatten that curve. I think that folks are doing a great job in the communities. They are certainly, you know, staying home. We do have testing capability in our clinics here and appropriate protective measures. So, you know, I'm very proud to be a part of this profession, and I definitely thank you, Governor, for your leadership at the state level, as well as advocating for us on the front line.
Well, thank you, Justin. Were you, did you have contact with the very first patient?
I did not, no, but our clinic and health system did, and it was something that we had to react to sooner than others, and it was fast moving, but I'm unfortunate that we were able to get through that process fairly well.
All right. Katie Bray from Harborview.
Thank you for having me on. My name is Katie Bray. I'm a critical care nurse at Harborview Medical Center. I traditionally work in the trauma surgical intensive care unit setting, but since COVID, I've been primarily working in the COVID intensive care units. I want to echo the same sentiments as Diane and Justin. Just really thanking you, Governor Inslee, for your strong leadership. When the UW system was first getting ready to address COVID, we were very mindful that we could have an inundation of patients and we were ready to surge to max capacity. Even though we've seen quite a few patients, because of your strong leadership, we have not seen as many patients as some other states have experienced. And I think that really speaks again to the fact of your strong leadership, really showing a good response from a state, as well as the community too. I think a key to keeping the COVID infections down has been the stay at home, stay safe, and for the whole community really practicing that has been so important. And even though it's been hard, it's something that we need to continue to do. And me and my coworkers have really reflected. This really is a time, looking forward and back, we're going to say the time before COVID and the time after, and things I don't think will ever be the same. And so I just want to, again, echo that sentiment. Thanks to everybody in our community. This is something we'll have to continue working on, but we've done a great job so far. And, it's hard, but, thank you. And I appreciate all the support from the community and our leadership, local leadership. Thank you.
Well, Katie, I appreciate you saying those things. I think Washingtonians have done a great job really getting behind this effort to save people's lives by staying home and staying healthy. And I appreciate you recognizing it. I think when you say it's hard, it's probably a lot harder to stand your shifts than to not have a haircut for some period of time. And that's why we want to honor you on Nurses Week. Katie, can you tell me a little bit what your day's like? What's your shift? What do you do? What's your day? What's your care level that you provide people?
Yeah, sure. So I work the night shift. So what my shift looks like is come into work and get ready to work 12 hours. Another area that I specialize in is I'm an ECMO specialist. So that's either a training.
What was that word?
ECMO.
ECMO.
It stands for extracorporeal membrane oxygenation. But to simplify it, it's basically when the lungs are so damaged and unable to work, a machine takes over that function. It's a complex machine, and it takes some special training to be able to take care of patients on this therapy. Because of the specialty with this therapy, if I'm the ECMO operator that night, I will plan on being in a COVID positive patient room for the majority of my 12-hour shifts. We have to wear, no jewelry, just our basic scrubs. And thank you to the community for sending us a bunch of free socks. That's not a fashion statement. We wear our long socks to make sure our scrubs don't drag on the floor, and drag COVID around. And then I have to gear up in all my PPE. And we are so cognizant of doing this correctly. There's actually a trained observer that watches me put on my PPE properly. And then I'll get ready to sit in that COVID room for 12 hours. And because we want to really limit exposure to other staff, we do take on a lot of those extra duties, such as some cleaning, taking out the trash. We try to limit when our radiology techs go in. So a lot of the times with these patients literally push the bed up to the window to get the x-ray. We'll take on that role of physical therapy, occupational therapy. When we turn patients, these patients need to be turned to not get pressure sores. Typically, for some patients, you'd have more than 2 people, but we're doing even some of that extra heavy lifting. We do have plans in place to make sure, I get my break, but a lot of the time, we take our breaks, but to leave the room, it's quite a process too. We have to clean the door simultaneously with a trained observer. And then as I exit the room, it's about a 5-10 minute process of making sure I've wiped down the equipment properly that I've been wearing or dispose of it correctly. And that gives me time outside of the room just to eat, drink, and go to the bathroom, and then go back in the room. Other staff members, we have 2 different types of PPE masks we wear. There's an air purified mask, which is kind of like a hood. And then there's the N95s, and sometimes staff will wear their N95s so long because we have to. And then the noses are red. We will have breakdown on our noses. It's really exhausting, but it's important work. And even outside of the room, we are adhering to those social distancing and universal masking. So when I leave, I'll put on a simple mask. And we are social distancing in the nurses station, as well as any work meetings. We're doing it via Zoom because those principles are so important.
It sounds like a long shift. Concentrate with 1 or 2 patients. That must take quite discipline for that long a shift.
Yeah, we have to be vigilant, especially when the room is dark at night. But it does give us an opportunity to really be with our patients and provide that emotional support as well because of the limited visitor restrictions. So as hard as it is for me, I couldn't imagine being in my patient's shoes, being scared, not being able to see my family regularly. And so that's why we do this work. It's really for our patients and for our community.
Are these patients conscious that are having this kind of therapy?
Typically, to tolerate this therapy, we will put patients on some sedation and pain medication to make sure they're comfortable. We really do want our patients comfortable.
Yeah, quite an art form. Could you tell me about what your situation has been with PPE? I know this has been a struggle because we've had to marshal it and make sure that we kept supplies. What has that situation been like either in the past or now for you? Justin,
Yeah,
Diane?
Oh, go ahead, Justin, Diane. I've done a lot of talking.
Yeah, this is Justin. I would have to say that, the PPE, thankfully, at least in my facility, we've been able to have access to PPE to be able to get through the day. But there have been times where, we had to look at the PPE that we were using closely and make sure that we had enough for, a few days out. I would have to agree that, there needs to be some action, at least nationally, to be able to get PPE to the areas that need it, especially both for our inpatient and our outpatient facilities. I would say in my experience being in an outpatient facility and a walk-in clinic, one of the difficulties with us is that we don't know, who may or may not have coronavirus. And part of that requires us to be protected at all times when patients come in through our front door. So what we have had success in doing is screening patients at the beginning when they enter the facility, separating patients out that have suspected COVID symptoms versus non-suspected COVID symptoms. So that way we can still care for the community for other healthcare needs besides COVID, but also be able to care for COVID patients in a safe way. So, part of that is making sure that patients come in with PPE or some kind of face covering, but also making sure that we as healthcare providers and frontline healthcare workers have access to, the face coverings as well as, cleaning equipment and gowns. So.
Well, this has been a central priority of our state because we know this has been tough and maybe not so much in yours. You might have been one of the luckier facilities, because I've heard stories that people have really had to reuse them and stock them and not clean them. And so our state's purchased about $18 million of PPE that's distributed so far on top of what your hospitals were able to achieve. And we have orders outstanding for about $370 million of additional PPE that we hope will be coming to continue to have healthy supplies. But this has been a real challenge for us. Now, we have challenges in the testing protocols at all, getting those test kits, but PPE remains a really high priority, and I hope that we can help your colleagues. What's been your situation, Diane, as far as PPEs?
Well, in the beginning, like I said earlier, I think everybody was pretty scared, were we going to have enough? And we saw what happened to the toilet paper, and we were kind of concerned the same thing was going to happen with the PPE. And we had nurses go out, diligent nurses, and go out and out of their own pocket buy PPE that they could wear up in our ICUs if they didn't feel like they might be having sufficient amount. We had a great response from our community. Multiple dental offices, as soon as they closed, they donated their PPE to us, their mask. There was talk about re-sanitizing the surgical paper mask that brought some concern to the employees, because it didn't seem like that was a very safe practice, and one that kind of got put through too rapidly, we thought, and what they were going to re-sanitize those with could be harmful to us. So we were happy that we're not utilizing any of those re-sanitized masks. We've all been fit, those of us that require it, with N95s, and we have those readily available now, or we can use the PAPR like Katie talked about if needed. And we're requiring all the surgical scrub nurses and techs to wear the N95s. And we're utilizing those in all of our endoscopy procedures now too. So Katie's right. We certainly at Centralia haven't had to wear them for 12 hours continuously like she has, but they are not comfortable and they're hot to work in. So
yeah, I can imagine.
Yeah.
What we're continuing our stay home initiative, but we have a phased approach to begin to allow people to return to some more normal activities. What would you say to people who say we should just abandon this effort now and just forget about trying to reduce the infection rate? I mean, what would you say to people who have that view?
Say it's going to be really hard if we have to abandon it and have to go back to a complete lockdown like we were. I think that would be so much tougher the second time around. So let's just try and work with what we've got now and move forward and try to keep bending that curve down. And we are going to have a new normal in the healthcare. There's no doubt about it. But as Justin said, we're still screening everybody that comes into our facility at the front door. We're using universal masking. We're social distancing. So we're practicing it as healthcare givers. And so the expectation is that the community at large is going to help us by practicing it also.
Any other thoughts, Justin or Katie, in that regard?
Yeah, I would definitely have to agree. As somebody that has to stay home on my days off as well, I can certainly empathize with everybody and the difficulty in, having to stay home. But what reinforces this is I see patients sometimes that we do send over to the emergency department because they are fairly ill, especially when I work my days in the respiratory clinic. And I think that, that really does reinforce the fact that people are sick, and these could be our grandparents, they could be our friends, our parents. And that really hits at home that, we need to identify the fact that there's going to be a new normal, and that there are some long-term, changes that we're going to have to make, but that we will get through this. But the hope is that we get through this now and not have to deal with a sudden second surge and another stress on both our healthcare system and our economy and our, the lives of our, our residents here. So I, would have to echo that, that our work as nurses certainly reinforces why we need to, pay close attention to what we're doing outside and try and stay home as much as possible.
Katie, some politicians have argued that because we have more mortality for people over the age of 60, that we should just sort of not worry about that group of Washingtonians. This may seem rhetorical, but I'm just going to ask you to comment on it. I mean, when you talk to family members, do they care less about their family members who are over 60 than if they're under 60?
No, absolutely not. And even though over 60 is a high risk group, I do want to make it clear to people that's not the only patients that have become severely ill and died from COVID. We have seen a lot of young and healthy people. So this can, one, really affect anybody. And we really shouldn't be measuring the value of someone's life based on their age. I think the early shutdown, we've seen some of the benefits already. And I think by continuing kind of a measured and data-driven approach, Washington's going to be better off. And even though we won't maybe reap the rewards right away, we're going to see in the long term with this measured, slow, thoughtful reopening that in the end, in hindsight, I think looking back, that's going to be the way to go to keep our community safe and to even help our economy in the end, so we don't have this resurgence and then back at square one.
Well, I really appreciate your comments, and I share them, and I have to tell you, I don't have a lot of tolerance with people that think that there are disposable people in this state. You know, I read a story about a 69-year-old welder in the Tri-Cities yesterday, and he sounded like he was a wonderful person, had a wonderful life and did great work and helped a lot of his neighbors at age 69. And somehow to think that those folks are just, you know, can be tossed away is very morally repugnant to me. And I think it is to most Washingtonians. And I suspect all the nurses who are dealing with folks. By the way, I want to tell you how long I've really appreciated nurses. When I was 10, I had a really bad broken leg and had some surgery, was in the hospital for a while. And I had a roommate who was badly burned. He was a young man, and his mother, he pulled down a pot of boiling oil. His mother was making donuts, and he was really badly burned, had a lot of pain. And he would call like all night, it seemed like sometimes, and he'd call for Mrs. Lemon. And in my mind, this is a long time ago, but Mrs. Lemon came 24 hours a day. And I still remember that. And I know that goes on every single day in our hospitals for people to give both comfort and professional services. So I want to tell you, this is not a new attitude for me. It goes way back to Mrs. Lemon in 1961. So I want to thank you for what you're doing. I think we're almost out of time, but I'd love to have, if you would all like to add something before we leave, any further advice for us or thoughts that we should be thinking about?
Thinking that the 60-ish is chronologically the disposable age since I'm over 60. And so thanks for not disposing of me, folks and community. But I also have a medically fragile husband at home. And so, you know, as Justin and Katie both said, and as you said, we're not only protecting our patients, we're protecting our community, we're protecting our family when we go home. You know, there was a joke out there that said, if you see somebody stripping on the front porch, it's probably a healthcare worker. And that's what we have to do, strip and go right to the shower and put our scrubs in the washer. And that's a new normal for us, one that, you know, I wasn't doing back in January. So again, that whole chronological thing, there's a chronological, you know, we know that we've got a lot of medically fragile people, and I don't think that we can put a number on when it's okay to say that, you know, it's okay that that patient passed or whatever. So again, thanks for your leadership.
Thank you. Justin or Casey
And Governor,
Katie? Yeah, go ahead.
yeah,
Justin.
I would just add that, you know, I think leadership is really what's going to get us through. In some ways, you know, we've had difficulty with having good leadership in seeing this through, but you know, at the state level, you've really advocated for us. And I think we need to continue to have that advocacy because we're going to continue to need supplies. We're going to continue to need PPE. We are not through this yet, and leadership is really what is gonna help us through this. Part of that requires listening to those of us on the front line. So I think that this conference call and press conference, I think, is important, so that way you can hear what is actually happening on the front lines, and I thank you for your leadership in that regard.
Well, it's easy. I have not seen a single flagger fail in their responsibilities, so it's easy to be on your team. Katie, do you have any closing comments?
I mean, I agree with Diane and Justin. This is truly a marathon and not a sprint. And, issues like continued advocacy for PPE is super important. And this has been hard, and it's going to continue to be hard. And just for people to remember that everyone's going through a hard time and to be kind to each other is my only other thought.
I would think that's pretty good advice. Well, listen, I just want to thank you. I think you've seen, anybody's watching today, the representatives about why this is Nurse Appreciation Week. People who really care. I mean, is there anybody who cares more about their fellows than these nurses right now? And they truly are on the front lines. I think that we owe them not just PPE. I think we owe them rational, scientific, health-based policies to reduce the number of people who are becoming infected, that the nurses then have to put their lives on the line to protect people who become infected. And I think that it is a fair thing for all of us to remain committed to see to it in the next coming weeks that we continue to reduce the number of people who are infected, so these nurses don't have to put themselves at risk. I think that's a fair thing we owe them, besides owing ourselves for our own health. So I want to thank these nurses for telling their personal stories. I want to thank their unions have done a good job helping them get the PPE they need, as well as other measures so they can do their jobs in a healthy standpoint. And again, I want to thank all Washingtonians who are sticking with this. We're kind of sticking to it kind of people. We don't give up easy. These nurses don't give up easy, and I'm pretty inspired by them. I hope you are too. With that, happy Nurses Week and Day, and please wash your hands. Thanks a lot.